Welcome, welcome. Please turn your attention to our interpretation team.
Good afternoon, everybody. Muy buenas tardes a todo el mundo. Habla Susan. Estoy aquí con mi cointérprete Karin. Somos de la Cooperativa de Justicia del Lenguaje Tilde. Good afternoon, everybody. This is Susan. I'm here with my co-interpreter Karen. We're from the Tilde Language Justice Cooperative. Esta sesión será interpretada al español porque será presentada en inglés. We will be interpreting into Spanish as this meeting will be presented in English. I'm going to explain in Spanish how to join the interpretation channel, and then I will explain the same thing in English. Si está conectada a través de su computadora, va a haber un botón que dice interpretación en la parte inferior de la pantalla. Simplemente haga clic en ese botón que parece un globito y luego escoja la opción para español. Si está conectada a través de la aplicación de Zoom en su teléfono o en una tableta, tiene que pulsar los tres puntitos para el menú de más. Luego escoja la opción para interpretación de idiomas, luego la opción para español y por último debe pulsar el botón que dice finalizado, listo o done en la parte superior de la pantalla. So if you are on a computer and you would like to listen in Spanish, or if someone starts speaking in Spanish and you want to understand them in English, click the interpretation button at the bottom of your computer screen that looks like a little globe, and then click the option for English. If you're connected by the Zoom app on your phone or a tablet, you need to hit the three little dots for the More menu, then the language interpretation option, then the language English, and then you have to hit the button that says Done at the top of your screen. Siempre pedimos que por favor hablen despacio y que y así vamos a hacer un espacio multilingüe para la inclusión de todo el mundo. We do want to just ask again to make sure that everybody speaks slowly and clearly, and that way we can have a multilingual space that includes everybody. Thank you very much, and back to the organizers.
Thank you so much, Susan. I just want to address something I see in the chat. If you are having trouble hearing the interpreters, you probably need to join an interpretation channel. Try joining the English interpretation channel if you're having any difficulties. Otherwise, please send us a message and we'll do our best to help you out. Okay, so good morning or afternoon, wherever you are, and many, many thanks to our interpretation team. My name is Brittany Eltringham. My pronouns are she, her, and I'm the Director of Safe Housing Initiatives here at the National Resource Center on Domestic Violence. Welcome to Transforming Shelter Access, Practical Tools for Program Coordination. I am a 30-something-year-old woman. I have brown hair and bangs, and I don't know if you can really see it, but I have a brown collared shirt on. We like to provide visual descriptions for our participants who might have visual impairment. If I could move us over to the next slide, you can see our session overview here. Some quick housekeeping notes. This event features closed captioning. In the meeting controls toolbar, you should be able to click the show captions icon. This presentation is also being recorded. We aim to make this a mixed ability and multilingual space. This takes everyone's commitment and effort to make a reality. For this reason, we typically limit use of the chat function as it's difficult to translate in real time and can be inaccessible to assistive devices. So please submit your questions using the Q&A feature. And if you have comments or resources, you can send them directly to the event hosts. Then we can read the questions or comments aloud so they can be interpreted. And while we aim to make this a mixed ability and multilingual space, we also know we're still learning and practicing how to do this well. Please reach out to us directly during the webinar if you're experiencing any issues. And we'll also ask about accessibility in our post-webinar evaluation. Please let us know your experience and ways we can improve. We know we have so much to learn and we really want to improve our practice. I think I've said this maybe a couple times already, but go ahead and reach out to us if you're experiencing any ongoing technical issues. But please note we may have limited capacity to resolve all issues while the webinar is live. Next slide, please. So this webinar, we are the National Resource Center on Domestic Violence, but within the National Resource Center on Domestic Violence, we also operate the FIPSA-funded National Capacity Building Center on Safe and Supportive Housing for Domestic Violence Survivors. Today's webinar will highlight The Grove, ReloShare's innovative tool designed to help survivors access safe shelter swiftly and efficiently by allowing housing programs to see and share bed availability in real time. We know that programs are facing funding uncertainties on top of their already limited resources. So we were thrilled and truly deeply touched to learn that ReloShare is offering The Grove free for 1 year to domestic violence, sexual assault, and human trafficking housing programs nationwide. Today, we'll learn about how the Grove works, how programs are using it, and what onboarding and ongoing support looks like for enrolled programs. We'll have time for Q&A at the end of ReloShare's presentation, but we may be able to stop for questions throughout, so please go ahead and submit them as we go along. Finally, while this is not an endorsement of ReloShare's products, we are hosting today's webinar in alignment with our goal at the National Capacity Building Center on Safe and Supportive Housing for DV survivors to improve responses to survivors of domestic violence and their families across the continuum of publicly and privately funded homeless services and housing programs. And with that, I'm very pleased to turn it over to Megan Rabbit, Director of Strategic Partnerships at ReloShare.
Thank you so much. That was such a nice little welcome. Thank you all for being here today. My name is Megan Rabbit. I use she, her pronouns, and I am also a in my 30s-year-old female wearing a camel-colored sweater with long brown hair and blue eyes. I am calling in from ReloShare today. As mentioned, I am the Director of Strategic Partnerships, and we're going to be talking about how you can use our tools to transform shelter access. We're very, very passionate about this topic because ReloShare, while we are a tech company, we do build platforms for social service providers and government entities with a focus primarily on housing. A little bit of background about me. I used to be a director of programming at a sexual assault and domestic violence agency local to me. I worked in many, many realms throughout the housing continuum throughout my nonprofit life before working at ReloShare. So I have a deep love and admiration for you all on the front lines who are trying to just every day get someone into safe housing. The objectives of today's call really are to recognize the barriers faced by those experiencing DV and housing insecurity. We will discuss the ineffectiveness of a fragmented housing system, and I know that a lot of you on this call will be able to relate to those examples. Discuss the importance of collaboration between service providers, demonstrate how to build a well-rounded community response to emergency housing. And then, of course, we'll end it kind of wrapping up with how our tools or ReloShare's tools may be able to be a solution for you all. So first and foremost, it is very important for us to understand the barriers that folks experiencing abuse face when trying to access emergency housing. We're going to go through some examples of the complex applications process. As most of you know, many housing programs do require applicants to fill out extensive housing applications. So this could be, from an emergency shelter's intake form all the way to transitional housing or permanent supportive housing, having full-fledged applicants or applications. These can be very, very lengthy and confusing and repetitive for survivors of gender-based violence to fill out. especially for those with limited literacy or language barriers. And we will talk more about that later. Another piece to this is there are always multiple applications. As you all know, again, individuals often need to apply to multiple different programs. They are applying to multiple different wait lists to just be the first one called, right, when that wait list is queued up. They each have their own requirements. They need different paperwork. It can be really redundant and increase frustration for the survivor filling these applications out. Another piece to that is gathering all of these necessary documents. So things like your ID, your birth certificate, social security numbers, proof of income, residency verification, etc., can be challenging for individuals who may have lost important documentations. I know as part of many of your case management services, you all probably are assisting folks in getting or obtaining these certain things as they are needed for the application processes. However, we know that that takes time. And with helping people navigate their housing applications and needing all of these documents, that can further delay their linkage to these housing programs that are vital. There can also be a digital divide. Now, again, I'm coming from a tech company, but that doesn't mean that there isn't a digital divide even amongst us. I laughed earlier with the NRCDV staff on this being our first time presenting with Canva, right? So we're all living, we're all growing. The digital divide is kind of increasing as new things come about, especially now in the world of AI. And many application processes are moving to online, which can be a barrier for those without reliable internet access or digital literacy skills. Then there is lack of information and awareness. There's definitely information gaps. Many people in your community are probably not very well versed on what services may be available to them. In addition to that, they don't maybe know there could be an inconsistent communication of what services are available. A real-time example of that, when I was working at Wellspring, which is again, local DBSA provider local to me, we did have a housing program or a hotel program. And word kind of got out throughout the community that we had this hotel program. But one of those requirements was that you had to be a survivor of gender-based violence, fleeing a dangerous situation. We did have community partners that were very well intentioned and they were just trying to help. But they did refer to our office time and time again, which only led to more frustration because the survivor or someone would be calling who was unhoused. They did not meet the criteria for that hotel program. And then they were left with maybe a sticky note that was like, hey, these are the numbers that you can try to call. I'm not even sure if they do provide these services, but maybe these programs can help, which undoubtedly is frustrating, it's time consuming, and it also just really like makes the person who is unhoused really have a lack of trust in the system because it comes across as disorganized, and that even us as service providers don't have all of those answers or consistent information. Then, of course, there's cultural and language barriers. Information about services may be available on pamphlets, but it might not be available in multiple languages or in culturally appropriate formats. So it makes it difficult for non-English speakers or those from diverse cultural backgrounds to access needed services. And then we have outreach challenges where outreach to marginalized communities can be limited, resulted in many people not knowing where or how to seek help. This is particularly a struggle right now. We're hearing from many, many agencies, which funding to increase efforts to have better outreach have been cut or diminished. And then it's making it even more challenging for folks to access the vital services that they need. Then, of course, there's always transportation and geographic barriers. One of the biggest things that we continue to hear at ReloShare is the lack of transportation supports, especially in rural areas around the United States. While this is not currently something that we meet the need for, we do hear it time and time again that there is limited public transportation or Ubers and Lyfts aren't available locally in these areas. So if they are limited, it does obviously make it difficult for individuals to travel to these services or into the housing programs or even opt into being in a housing program because maybe it's out of the school district of the family or it's not local to the very vital health services that they need, etc. And then kind of that goes into the distance of services. Then there's accessibility issues. We know, and this is one of the things that the Grove aims to help support, that oftentimes individuals may have physical disabilities or health conditions that make it difficult to travel or, not even be able to be enrolled in service locations at all because they are not fully accessible. One of the things that we will talk about later is the way that the Grove does capture ADA accessibility features that are available throughout the home or the agency that has a housing program. And then there's, of course, safety concerns. Traveling to certain areas may feel unsafe, especially for individuals experiencing gender-based violence or those at risk of exploitation. So I want to move into the importance of a well-rounded community response with some very key examples of things that we hear time and time again, both in my former role, but especially at my time at ReloShare. So some of the pain points for victim service providers can be shelter limitations. There is an inconsistent availability of shelter beds. We're going to go through the point in time count later today. And you'll see that there is a clear need for even more emergency beds, which this was the first year that was a huge gap because the homeless population has increased 18%. Then there's the overhead costs of shelter operations. It becomes increasingly more expensive year over year to run a sheltering program. And when these programs are consistently seeing funding cuts, it can be very difficult to even meet the basic needs of keeping the lights on, making sure that the fridges are stocked, that if there is a need like a burst pipe or something, that you can mitigate that and meet the needs of the people that are living there. Then, of course, there's hotel limitations. So I know some of the people we talk to, maybe even people on this call today, establishing relationships with local hotels can be extraordinarily challenging. It can be something where you maybe have an MOU with a manager and then that manager leaves and then the MOU is lost in translation. It could be that there is an inconsistent practice with pricing. So that can be a very big limitation on folks even wanting to offer hotels as an option. And then, of course, there's difficulty in real-time communication and updates with that hotel. And there will consistently be administrative or bureaucratic pain points for victim service providers, of course, administrative burdens and resource limitations, something that we will definitely be talking about later as well. So VSPs struggle with outdated systems. It, again, has a massive impact on social service providers. I was personally speaking with a DV coalition last year and was told that on average, their member programs were each calling 27 places daily to get housing updates or trying to attempt to secure shelter beds for the people they support. That is a massive lift and a time-consuming practice that many VSPs face each and every day they clock in. Then again, to kind of go over the nonprofit and hotel relationships piece, we have had a current Safe Stays user come to us to find help after they were navigating many different partnerships with 2 local hotels. One hotel offered flat rates, but they consistently billed incorrectly, and the agency was charged 3 times for the same stay. They did not catch it in time, And then unfortunately, it wasn't until they had their audit that they realized that they were billed 3 times for the exact same person this day, and there really wasn't any recourse back. Another piece of that was one hotel required the agency to come in person to put down a credit card and continued to send the folios to the guest, which not only is extremely risky, especially if that guest has returned to an abuser, but having to constantly send someone out, a staff person out to physically hand another front desk agent the credit card is obviously time consuming and can be really challenging and something I definitely relate to as someone who led a hotline team. So I remember very clearly that 2 in the morning phone call where you're running to the hotel to check a guest in. And then there's a lack of continuity of care. So one domestic violence survivor may need to physically visit over a dozen locations to access services, housing, and support. Um, Obviously, that can be extremely challenging, but this is not something that is uncommon. Survivors may have to complete applications, intake forms with the same information numerous times. And not only does that create frustration and burnout, but it may take time, they may have to take time off of work, school, find transportation to attend appointments, or to submit applications. Again, they may be getting their housing, their emergency housing from one program, but their legal services from Legal Aid Society. They may be going into family court and they're represented by another type of attorney. They may be going to the food bank or the local food pantry, or they're going to the Department of Social Services to get SNAP benefits. This is so challenging to remember all of the nuance just to get your bare minimum basic needs. And we know that this isn't only frustrating and causing burnout, but it can really be re-traumatizing. As you all know, to access these services, survivors often have to repeat their stories. So they're going to repeat their stories with every single service provider they have. And we even had a survivor reach out and say that receiving 10 pamphlets is really overwhelming. At that time, I was comfortable telling my story, so I didn't want to tell my story. I wasn't comfortable telling my story, so I didn't want to tell my story 10 times at 10 different places. If I had one place to go that could tell me that I could tell my story once, that would be much less overwhelming. And then, of course, survivors may be placed into housing programs not suited to their needs. As I mentioned before, the availability of beds is very rare, right? Like we all know that our local shelters are at capacity pretty much every single day. So oftentimes that means that survivors aren't being placed in the program that's going to be the best fit. They're being placed in the program that has the first available bed, which probably isn't going to have the best possible outcome. And then, of course, there's inconsistent information, which we talked a little bit about earlier. We did, just for an example, if an advocate refers a survivor with 2 children to transitional housing program that they have a pamphlet about, the program gets client into housing within 1 week with minimal application intake process. A month later, survivor refers single survivor, no children, to the same program, and based on prior experience, suggests the application process will be minimal. Instead, survivor has to meet with the program 2 times in person and provide a referral form that the advocate was unaware of. So again, even from survivor to survivor, they may feel empowered to say, this was my experience at this location, but now because of funding cuts or this agency no longer provides that service, there may be a disconnect in the survivor experience, and that's inconsistent, which is of course not what we want. And then, of course, there's inefficiency and waste. As I mentioned before, even having your team go out into the middle of the night or even during the shift to put their credit card down for a hotel or walk someone through the process of the same type of application, just in 3 different programs, which is a really siloed approach, can be duplicative, which often wastes time and resources that can be used more effectively. So I'm going to quickly go over this case example. I'm keeping an eye on the clock, so I want to make sure that we have plenty of time for everyone's questions at the end. But let's just do a nice little case example. So let's say a female survivor with an emotional support animal calls the local county's DV hotline, and they're seeking emergency housing. They disclose extensive history of physical, sexual, and emotional abuse, including a recent assault. So the danger assessment or lethality assessment was completed. The county DV hotline refers the survivor to the county DV shelter that they have an established MOU with. We'll talk a little bit about the standard assessment and referral procedure in a moment. Um, the hotline provides the danger assessment or lethality assessment to the shelter. It expedites entry into the shelter. However, the survivor is asked to disclose the details of the most recent event for the second time during intake. Then the DV shelter refers the survivor to a local animal shelter for temporary boarding of their emotional support animal. The DV shelter completes referral paperwork for the animal shelter. However, the survivor must coordinate transportation to that shelter. And without a car or access to a pet-friendly public transportation, she must disclose the recent incidents in order to explain or request a ride from a friend. So it's the third time that that person has had to retell their story. Now, the survivor has had a 30-day maximum stay at the local shelter without the emotional support animal. So they receive supportive emotional and mental health services during their stay. However, she is only able to see the emotional support animal once a week due to the location and lack of transportation. Separation from the ESA is a significant barrier to survivors' healing, and she feels isolated. Now, I know that this is a case example of the fragmented housing system, but this may resonate with one or many of you on this call because I'm sure you all have a specific case example that would be very similar to this. So a little bit about the per standard assessment. So a local victim service organization had funds to pay for a pet-friendly hotel room and transportation. However, the hotline shelter MOU dictated that all female DV survivors with a danger assessment or lethality assessment scores over a certain number to be referred directly to the shelter. This strict protocol created unnecessary barriers for survivor and negatively impacted their healing process. So again, just to reiterate, even the best intentioned processes can also place someone's healing journey at risk. So, what could have been something that would have been able to meet their needs, they would have been able to stay at a pet friendly hotel, they would have been able to be covered for transportation. The MOU dictated, or this, they had a process or a procedure that if the DV survivor scored over this certain number, then they had to be directed to the shelter bed. So again, well-intentioned process, but also the long term, if we look at the full picture as a victim service provider, we may have been able to foster healing a lot more quickly. So some resources, as I mentioned, we do very heavily look into like the point in time count that comes from the annual homelessness assessment report, as well as NNEDB's DV counts report. So just a few things that we know. 38% of victims of domestic violence become homeless at some point in time in their lives. That is a huge statistic. It's a huge risk of homelessness. And on a single day in 2024, 50,188 victims of domestic violence were refuge in emergency shelters, transitional housing, hotels, motels, or other housing provided by local programs. That left 8,457 victims of domestic violence with an unmet housing need. What we need to know. So as we look at this, we can say, well, how can we use this data to assist in making this a little bit better, right? We need to know how many shelter beds sit empty each night. So HUD reporting versus DV shelter reporting, it's different, right? It's not the same. It's not capturing the same things. How do we work together to improve efficiency and access to housing? So how can we in our communities work more collectively to meet the needs across county lines, town lines, state lines even, because as we know, the bed availability is so low. Moving over a little bit to NNEDB DV counts report, as I mentioned before, so there was 14,095 unmet requests for services in general. The majority of those unmet requests, 60%, were for emergency shelter, hotels, motels, transitional housing, and other housing. That is a 6% increase year over year. So again, even the data is suggesting that there is definitely more of a need. And as there's more of a need, we're also seeing the bed availability decreasing, especially for emergency beds. So looking at the National Homeless Survey, the point in time count collected 771,480 people who were unhoused. This is an 18% increase year over year. For individuals, they saw a 9.6% increase. For families with children, they saw a 39.4% increase. Chronically homeless was 6.6. Veterans actually went down. It had an 8% decrease. But unaccompanied youth had a 10% increase. And if you're looking at the inventory by bed, you can see that the total year-round bed number is 509,710. We have some seasonal use beds and then overflow voucher beds. So one of the things we also look at, and this is again from the AHAR or the Annual Homeless Assessment Report to Congress from 2024, we like to look at, you can see there was a massive increase in permanent supportive housing beds from 2007, excuse me, to 2024. But if you narrow that down to post-COVID, you can see that there's actually not much of an increase for each. And from 2023 to 2024, we even saw less of an increase. So for total shelter beds, there was only an increase of 13.4%. Again, with the number of unhoused individuals going up 18%, there is a clear disconnect in these numbers. And then for permanent housing beds, that was even less at 2.7%. And we know that permanent housing programs can really, really stabilize someone. So looking into obviously growing that number as well. So this again is more data and just being conscious of the time. You will have all these slides so you can go through some of this data as well. But this is from the domestic violence specific bed occupancy point in time count. 2023 was the last time they had a report for it. So this is some additional numbers for gender-based violence beds in particular. But we can move on to, again, ReloShare's tools and how we can potentially be a solution to support coordination efforts moving forward. As mentioned, ReloShare is a tech company. We value all of the work that you do, and we don't just say that, we actually back it with our mission and vision. We do so. I'm not an anomaly here. A lot of the staff that work at ReloShare actually come from the victim service field. We have folks that have worked in policy, have worked in statewide coalitions, have worked at DA's offices, have worked at human trafficking organizations, etc. So we're extremely passionate about all that it is you do, and we're trying to streamline that process as much as possible, knowing that there are even more challenges than when we moved away from the work. So again, we don't just say that we're passionate about housing. It is embedded in our vision and our mission. Our vision is to ensure that no one is left without a safe place when they need it most. So you may have heard of Safe Stays. We'll talk a little bit about Safe Stays in a bit. Today, we're primarily talking about the Grove, but I think it's important to go over the way that we support this continuum of care, right? So our products really do offer a full lens into supporting your emergency housing efforts. Where the Grove is a real-time housing coordination platform, it really just makes it easier for agencies to see and share bed availability across that housing continuum. Safe Stays allows agencies to book hotel rooms for their clients under an alias name and without the need of a credit card. So in moments where maybe there isn't a great fit, or maybe they're all at capacity and you want someone to stay more local, Safe Stays allows you to offer the opportunity of staying in a hotel room instead of a shelter. So as I mentioned before, the Grove is designed to help agencies see and share bed availability for emergency shelters, transitional housing programs, permanent supportive housing programs, and then agencies that are maybe don't have brick and mortar housing, but they do offer hotels as an emergency housing solution. Beyond just showing you bed availability, though, we do have specialized filters to find the best fit for the person you are serving. As mentioned before, you can search for not only emergency shelter, but also other housing types. And it allows you to get the full picture of the housing program, including things like the services, accessibility features, intake processes, population served, etc. And then we do have a support and accountability team as well to assist you through your Grove experience so that the weight can be lifted off of your agency. So anything from, we had some high turnover, I need a new training for the product or for the Grove, we could be there for you, of course, at no cost. I need help resetting my password. We are there for those moments, all the way to we need a letter of support for this grant, or we want to source some grants that might be able to equip us to start a hotel program or start a housing initiative. We can be there for you in those moments as well. As mentioned by Brittany earlier, we are so excited about this Meeting the Moment initiative. We understand that y'all have really gone through it over the last year, especially with funding unknowns, forcing many housing programs to stretch already limited resources. We understand you have made some devastating decisions that have affected teams, that have affected programs, that have affected services, and we just want to do our part in ensuring that you don't have to worry about one extra bill. So we are offering all housing programs, again, whether it's emergency, transitional, permanent supportive, or hotels, free Grove accounts for up to 12 months for all gender-based violence programming. We understand that real-time data access can help provide, yes, Fatima. Oop, I think we had an accidental hand raise. Let me know if you need anything, Fatima. No, you're okay. So we do understand that real-time data access can provide or can assist with advocacy efforts. It could help you understand where the gaps are in your communities. It can understand where maybe you need to funnel more resources. So we're happy to assist with that as well. And we're hoping that providing the 12 months free allows providers to really be able to coordinate better amongst one another so that they do not have to worry about, again, paying for that, but then they have the data to back up that need. So a common question that we typically get asked is cost beyond that year. We do 3 different types of partnerships. So you can be a housing program. So again, if you have an emergency shelter, transitional housing program, or permanent supportive housing program, or even maybe you want to receive referrals for your hotel program, you can do so as a housing program on the site. We also have affiliated agencies because, again, we are passionate about building stronger communities and increasing the more streamlined access to housing in a community-driven way. So what we call affiliated agencies would be agencies that essentially don't have housing programs, but they are vital in this mix of referring people to your housing programs. So those agencies can receive a discount for their first year. And then we have enterprise organizations. So that would be like your statewide coalition, or maybe you run a statewide hotline or a national hotline. You have the ability to be an enterprise organization where essentially you can cover the cost for other agencies in your area, and then you would get an enterprise account with enterprise data affiliated with that. We in no way share individual housing program data that would be telling of that housing program, but we can provide things like anonymized aggregated data that would help you in the community go to your statewide legislators or maybe even your national scale federal government and say, this is where we need to be putting more money to support our efforts, especially as funding continues to be cut. So again, beyond that, housing programs are free for this first year. Affiliated agencies are discounted, and it is $6,000 for the first year. So I'd love to give y'all a little bit of a sneak peek. I do see some questions in the Q&A too, so I'll give you a little rundown as some of this may answer the questions, but I promise I see them and I will get to them. Okay, so let's actually do this quick walkthrough. I just want to confirm that y'all can see a screen that says the Grove demo in the upper left-hand corner. It also says like ReloShare as well. Awesome, thank you, Vanessa. So this is a very quick walkthrough video that y'all can see a little bit about our program. We definitely have so many features that I'd love to chat with you individually if that's something that you are interested in. But essentially, this is the Grove where you can find housing programs that would meet your client. So say, for example, you had a client come to you that has a need for housing and you were not able to meet it, maybe because your housing program was at capacity or your agency there wasn't a great fit around. So you can look up the client's preferred location to begin the search. I'm going to type in Chicago here. You do have the ability to expand the search mile radius out. So we do it up to 500 miles. This is especially great for maybe folks working in human trafficking, where they can look states away. They maybe don't know all of the area or the shelters in Arizona, but that's where maybe that person has family or support. So they can look up the state and then just expand this out. Then bed type, think of this almost as the size of the family. So is it a single, someone requesting a private space, or maybe it's a family of 4, 3, 7, whatever that might be. Then you can select the population. So the way that we break this down is population specific. We also do gender and youth beds. So for example, if I was working with a domestic violence survivor, I could select domestic violence. Or if I was working with someone who maybe is experiencing homelessness for the first time, they, are not fleeing sort of any domestic violence situation, I could do homeless singles. We do have the ability to filter by women, men. There's a subcategory that also drops down to support trans women and trans men that will display shelters that have indicated they're trans inclusive. And then we also have youth and transitional age youth beds as well. So then I can hit search. Once I see or hit search, I will see all of the housing programs that meet that criteria. I can show which ones have availability. And I can even filter by which shelters are taking intakes right now. So what that means is if you do get a 2 a.m. phone call, you have the ability to search at that 2 a.m. mark. And what this is going to do is draw from the intake hours of each housing program, and it's going to filter out the programs that are currently accepting intakes so that you're not calling an agency and seeing, oh, okay, I have to call back the next business day at 9 a.m., for example. You can select the type of housing. You can select needs. So does the person need a crib or maybe a floor level bed or an accessible room? Or do you need a program that allows them to hold on prescription medication, sobriety required, one that's pet friendly, etc. You can make those filter requests. Safe Stays is integrated into the platform. Again, we'll chat a little bit more about that later and why. And then if you want more information about a specific housing program, you can make that selection where you'll get brought to the housing details page and you'll have even more insights into this particular housing program. So things like the languages that the staff speak, if they offer a wait list, if they offer accessible rooms, and what accessibility features are available, right? Everyone's going to say they are ADA accessible. What does that mean? Right? When we're trying to really link someone to a program, we should be empowering them with that information up front so that they're not having to tell their story only to be told that that program doesn't have the support that they need. A description of the housing program, featured amenities, intake requirements, services that they provide, again, current availability. And then we also have some additional bed types as well, so that not only are we saying, yes, this agency has one bed available, we also know that this bed is a floor level bed. Now, if I was interested in requesting an intake or saying, okay, this client says, yes, this meets all their needs, how do I access this program? You can click the request an intake button. It will pre-populate with all of the intake instructions directly on the screen. So you can help walk your client through those intake instructions. And then if you would like, we also offer the opportunity to text or email those instructions directly to that client if it is, of course, safe or even possible to do that. We do not store client identifiable information, so we purge their number or their email immediately as soon as you hit the send information. But then we also document that in a nice dashboard so that, again, your agency can use this information to continue to advocate for the vital services that you all provide. So you'll see all of the referrals that your agency made. And if your agency is a housing program, you would have access to all of the incoming requests as well, where you're able to essentially just wait for that client to follow those instructions. And you can say whether or not you are denying or fulfilling that request. You, of course, have the ability to access all of your program details and adjust accordingly, but also download reports month over month to get all the vital information so that you can continue your advocacy. And that's a little bit about the Grove. Again, I can talk about it forever. We absolutely love all of the features that are available. But if you are more interested in more information on this, I will have my email on another slide and you can get a hold of me to see if it's something that you want to explore with greater depth. So again, as I've kind of been talking about throughout this presentation, we know at ReloShare that hotels can be a vital or necessary safety net. When shelters are full, when options are too far, when there isn't a great fit, or even when the stay is brief. So, say this person just needs to flee, they have an apartment ready to go the first of the month. We just need to have them in a place for 3 days. It might be better to have them in a hotel with like a kitchenette so that makes their stays a little bit more comfortable, especially if they have like a larger family or maybe the other barriers that necessarily won't fit into a smaller shelter. So we do have Safe Stays. Safe Stays, again, is a free-to-use nationwide platform. It functions very similarly to hotels.com, bookings.com, Trivago. If you've ever utilized any of those platforms, think of Safe Stays just like that. The biggest difference between Safe Stays and those programs are it is not public facing. And we also do not require you to have a credit card at check-in. So we don't take payment up front at all. We pay for the stay up front, and then we bill your organization after the fact for all of the previous month stays. The rates you see on our site are the rates you would see if you were to Google the hotel itself. We just remove that barrier because I know we would regularly receive emails from our finance director saying, please do not use the agency credit card. We are maxed out for this month because we may have placed one person in a hotel. So no need to chase down your finance director. We will pay for the stay up front and then bill your organization after the fact. We do also work with hotels that offer alias approved bookings. So what that means is your clients do not need an ID at check-in. They can just go under an alias name. They're not going to be asked for an ID. They won't be asked for a credit card, of course, at check-in for incidentals, and they can stay anonymously at one of those hotels. We do offer 24/7 booking. So no matter what time of day those needs arise, our team is available to help navigate those bookings. And then we offer consolidated billing so that you're only paying one invoice as opposed to all these various hotels, especially if you're placing people in hotels frequently throughout the month. You would get one bill to pay, and then we give you those individual itemized receipts so that you have access for grant compliance. So I really like to kind of pose things ahead. Again, I will give you my contact information, but just some things I like to have people ruminate on after a webinar. Really reflecting in to your individual programs, and thinking, where do ReloShare's tools align with your organization's housing priorities? Could Safe Stays or the Grove strengthen or complement the things that are already working? You know, we talked a lot about some downfalls or barriers today, but I don't want that to overshadow all of the great work that you do, because we know that y'all are getting very creative to continue the services that you do provide to folks. So, are there ways that Safe Stage of the Grove could help strengthen those efforts or complement what's working? And then, of course, what challenges are top of mind that ReloShare can help address? We love strategizing with all of you. Please, by all means, if you ever want to meet with any of our team, we have expert housing calls regularly with programs to really talk about your needs, the things you're seeing, the barriers that you're, up against, and then if there are ways that we can be flexible or talk about solutions, or things that we have seen or heard. We love to have those conversations. So please, please, please reach out to us. Above everything, I just want to thank y'all for having me here today. I do not take it lightly when we are allowed the opportunity to speak to such wonderful programs. So, and I also don't take it lightly that programs are stretched thin, and hopping on an hour and a half call can be a lot. So I appreciate all of you in the room today. If you need to get a hold of me whatsoever, feel free to reach out. I like to shout out that my last name is Rabbit, but it's spelled with two T's. So if I'm not responding to you, it might be because you forgot the second T, but it's here. You can email me anytime and I'll get a hold of you. And I just really appreciate all that you do each and every day. I'm going to switch over quickly to the Q&A and see if I can answer any of these questions. But if you have any, please feel free to continue to add into the Q&A and I'll get to them. So Christina asked if the Grove will be a service agencies must pay for after the first year. Is that a subscription-based payment structure, and at what cost? Really great question. Christina, our goal, honestly, is to hopefully be able to provide the Grove free long-term for housing providers, but we want to be transparent with you all and say that right now what we can offer is the first year for free. Beyond that, it is $500 a month or $6,000 a year. And we can help work with your agency or your community in finding or sourcing funding for long-term integration. So as that year is, as you're in your year trial with your community, we will be in touch with many, many, many different partners to see if we could get that covered for your housing program long-term. We do not want to see it come out of your individual agency budgets. So we can strategize around you all and your community. The next question is, I know the National Hotline has DV beds, which is also meant to be a national shelter bed tracker. I'm not sure how much you know about their program, but can you speak to the similarities or differences between your sites? I wonder about how having several platforms for the same purposes might result in less consistent updates from participating agencies. I love this question. Thank you so much for whoever asked it. Yes, we are very familiar with DV Beds. We have a wonderful working relationship with the people over at DV Beds. The National Hotline has taken ownership of some of their program, which we have a wonderful relationship with the National Hotline as well. So we work in alignment with the National Hotline and their needs. We actually have the same API structure or backend connection that DV Beds has with the National Hotline to make it easier for the National Hotline to, when they receive a call, to see who has open beds. So it's a very similar structure that DV Beds has, all in this working together collectively. I would say the biggest differences, to my knowledge, I haven't seen DV Beds in a few months, maybe even 6 months now. So I'm not sure if they have expanded any of their features. But the biggest, I think, differentiator for us is that we believe in full communities and a full wide coordinated community um, approaching this vital thing of streamlining housing processes. So where DV beds only works with agencies that serve DV survivors, we work with any type of organization that has a housing program. And that really helps, especially for programs that are regularly being referred, folks that are maybe an inappropriate fit because they don't meet the criteria. It allows agencies a tool to go back and say, okay, how can I help this client into housing? Even though I can't support them in my program, how can I help them into a program that will be able to support their needs, as opposed to the traditional, here's a number you can try, and then pass it across the desk. We also do provide reporting for both housing programs, so they all get their vacancy information and all of their incoming and outgoing requests. We provide reports for affiliated agencies. They can see all of the referrals they made because we know that giving these agencies that information back to them, it's their information, can help with the advocacy efforts as well. So I think those are the biggest differences between the two of us. It looks like a follow-up question. Would it be at a cost for programs entering in data, or is it just a fee to access the data, or both? So and I'm going to make an assumption here, Christina, so please correct me if I'm wrong, that when you're speaking to entering in data, I'm assuming that just means like offering bed updates every day. And the way we break it down is housing programs, so they would be updating their space every day. They get access to the free 12-month year for the meeting the moment. So whether they're entering in the updates or not, they still are getting that free year. They also, affiliated agencies can also send referrals over, and we technically capture that as data because they are still sending out a referral. And while we're not capturing any personally identifiable information of the clients, we want to make sure that they have that information documented so that they can use it for their advocacy efforts. So affiliated agencies have a fee, housing programs do not. Enterprise level agencies like statewide coalitions can cover the cost for their programs or their member programs. And if they do that, they get a free complimentary account. So they have access to it. But they also would get the anonymized aggregated data of all of those programs within their network. So they can see things like, what is the percentage of the agencies that are pet friendly? What are the percentage of agencies that have XYZ accessibility types? How many have floor level beds? How many days in the past year have we had no availability with my member programs, right? Like they can really get some valuable insights that's not telling of the individual agency, but is good when they're trying to look at, okay, where do we need to spend more resources in? How can we get more low barrier options, et cetera? It just helps inform communities a little bit better. Is this something that system-based advocates can participate in? Yes, I believe I may have mentioned that in the chat. I did see this question come up before I was presenting. So absolutely, system-based advocates can participate in this as well. We would call that affiliated agencies. So people who are vital in the services that they offer, but maybe they don't have housing programs, they can refer. Absolutely. Oh, really great question. So someone asked, can you share what the cost to a coalition as an enterprise org would be for year one? If you want to email me directly, it depends. So what that depends on is the amount of organizations that you are covering. So we have it kind of broken up in tiers of like 10, 25, 50. So it depends on how many. And the more you cover, we can cut the cost or get a higher discount because we understand that like essentially you're covering the cost of a lot more organizations. What is the vetting process for housing programs to be listed in the Grove? Love this question. Do entities have to renew annually? How do you ensure quality of housing services being provided? I absolutely love this question. I know I keep saying that, but I do. I just love questions in general. So we have a very light vetting process to get access to the Grove in terms of we want to make sure that agencies are obviously who they say they are. We look up your EIN, we make sure that you are in good standing, that you have a housing program, like all of those things. But we want to be very weary of making a like certification process or vetting process. And this is where we lean heavily on our trust and advisory council. So we have folks from NNEDV, Ujima, Polaris, etc., that we talk to regularly about like what our vetting process looks like to ensure that we are not having any sort of like bad faith actors having access to either the Grove or Safe Space. We want to make sure that we have folks, but we also have the ability to get a feedback loop. So if programs, for example, are like, hey, just so you know, this program was cited for XYZ, they could let us know that. And we take those claims very seriously. So we'll look into that. But we want to be very careful about us being the certified body. We want you all experts in this field. We've all kind of, while we work in housing, we've sidestepped away from the work. So we lean in heavily to our national experts to ensure that they have it. For human trafficking in particular, we know that Safe House Project has a certified process. We know that some other folks are looking into doing a certification for housing programs. So we would love to chat if you know of an organization that does have a certification process that you love, because we want to lean into your expertise. How does the program know how many beds are available? Does it rely on those shelters participating and updating their date? Yes. So essentially what that looks like, we have a few different ways housing programs can update their space. They, of course, can do so on the platform. So they can log into their platform and update their space. But we understand how manual that process can be, especially because I'm sure y'all have many, many different logins. So we offer the option for agencies, and this is a full option, where if agencies would rather update their space via text, they can do that. They can provide a mobile phone number. And essentially, it's just a prompt that they get sent every Monday through Friday. And it says, hey, this shelter, this is the last update we have on file for you. Is this still accurate? Yes or no? And if you say yes, say you're just at capacity all the time and you're saying yes, we say thank you and we update that timestamp on the site. If you say no, we'll then start asking you questions that you'll just answer via text. Very quick. It's just like, how many beds do you currently have? Okay, we have 8. How many rooms do you have? 12. What is the maximum room occupancy of your largest room currently available? 4. Whatever, just for example. As you do that, we say thank you, and then we update all that information on the platform. So you do not need to log in to keep your bed space up to date. And we have found that the agencies that are on the platform that use text to update do so almost every single day of the week. We have a really, really good text to update option. Is there a fee for using Safe Stays feature hotel booking site? No. Great question. No, there is no fee. We don't tack on a fee for any program utilizing Safe Stays. Oftentimes people are like, well, how are you running that platform? So essentially the way that looks is because we are booking several, 1,000 hotel rooms a day for programs, we get a slight discount on that rate. And that is the rate that we pay our team with. We want to ensure that we can continue this service completely free for you all. So that is what we use to pay our team. So really streamlined process. We're very passionate about making sure that it is free. There are some ways that you can add on a fee if you say are nervous about damages, for example. We do have Safe Stays Plus as an option, which essentially just allows you to tack on a fee of I think it's $15.59 or something a night. And if you do that, then there are certain damages or that you would be covered for. You wouldn't have to be out of pocket. But again, that's an opt-in and it's not something you're automatically opted into. No apologies at all for joining late. Thank you for being here. Will the recording be sent out? I believe so.
Yes.
And thank you. And are most shelters DV not accepting males ages 12 and older? That is such an interesting question. And we do see that. But that is something that the Grove actually lets you spell out. So if there are those restrictions on an age group, we do say like youth, males, youth, females, youth, non-binary, and you can actually go through and just say like we accept, female, youth, females 0 to 14, males 0 to whatever. You can spell it out however you want. And we do see some programs have that restriction. And we can assist with how to support a family that may have a male over the age of 13 if that is a restriction through hotels. So we are happy to talk about program development on that so that all people can be served appropriately. Great. I think that is all the questions in the chat. Thank you so much for whoever was answering those and marking them as answered. I appreciate that. I'm going to pass it back over to Brittany. Thank you all so much again.
Thank you so, so much, Megan. I see a few comments that folks send to us. Someone said that this is a total game changer. So we really, really appreciate you coming to share about ReloShare's products. And thank you all to our attendees for being here. It looks like we're going to wrap up a few minutes early. And so in closing, we just want to let you folks know about our website, safehousingpartnerships.org. If you have questions or need technical assistance or training, you can reach out to us via that website. And we also on safehousingpartnerships.org host a resource library with hundreds of resources at the intersection of domestic violence and housing and sexual violence. Next slide, please. This website, Clearinghouse, the resource library that I mentioned, these capacity building materials are meant to do a few things. They're meant to help continuums of care develop partnerships with culturally specific programs and victim service providers, to integrate trauma-informed assessments for housing and safety needs into a coordinated community response, to enhance the ability of organizations and advocates like you all to improve coordination across services, and to help identify policies and practices that promote positive outcomes, resilience, and stability for survivors and their children. So visit us there, please. We look forward to staying in touch with you folks. Next slide, please. You can also connect with us here. I hope I need to confirm. There's a slight chance I didn't update our phone number, but I will see. Perhaps a better place to reach us is at housing@nrcdv.org if you'd like to get to us directly. And you can also find us on Facebook and Instagram. Next slide, please. This is just our grant disclaimer. This webinar was made possible by the U.S. Department of Health and Human Services, but its contents are solely our responsibility at NRCDV and do not necessarily represent the official views of the U.S. Department of Health and Human Services. Next slide. And so in closing, you can use this QR code. Otherwise, we'll put a link into the chat. Please complete our survey. We want to make sure that we are providing you the best webinars that we can on the topics that you folks want to see. So we really appreciate any feedback that you can offer us. Thank you so much for being here, and many, many thanks to Tilde for your interpretation support and partnership. And we'll also share a link to their survey as well. Thank you all so much.